Hello, my name is Sandro Galea. I have the pleasure of serving as Dean of the WashU School of Public Health, and welcome to Public Health Ideas. Today, I have the privilege of speaking with Dr. Rebecca Messbarger. Dr. Messbarger is Professor of Italian in the Department of Romance Languages and Literatures at Washington University in St. Louis, also with a secondary appointment in the School of Public Health. Her work looks at how ideas about health, illness, and society evolve over time, and how these ideas shape the practice and policy of public health today. Dr. Messbarger and I are going to talk about what history teaches us about health, and how the humanities can enrich the way we understand and pursue the well-being of populations. Dr. Messbarger, Rebecca, welcome.
Thank you. I'm really happy to be here.
So let's start about you. Let's start about your background. Tell us about what brought you to study of history, and particularly the intersection of history of health and medicine.
Okay, it's a little bit of a complicated story, but I'll try and be quick. So I was trained at University of Chicago in Italian literature. And when I was doing research in Italy on my first book, which focused on the representation of women in 18th century public discourse, and to, I think, many people's surprise, women had greater public authority than anywhere else in Europe in the Italian 18th century as scientists, authors, journalists. And I kept running into the name and reference to a woman anatomist. And I couldn't find really anything else, but I thought I'll go back and look her up. And I discovered that she was an anatomical modeler, and all of her graphic, life-size anatomical models were in the Faculty of Anatomy at the University of Bologna. So I got a grant from the Mellon Foundation, the greatest grant in the entire world, called New Directions, to retool and go back to graduate school. So I went back to graduate school at University of Wisconsin in the history of science, medicine, and technology. And then I went to our med school and took gross anatomy and went to a bunch of surgeries because it was really important to me to see the imaginative leap that this woman anatomist made from dissecting hundreds of cadavers in her house to these living facsimiles of the body. And then I went back to Italy and did a deep archival dive, and that turned into my book, The Lady Anatomist, and sort of the rest is history. I work at the intersection of medicine, public health, criminal justice, religion, gender. And that's how I ended up co-founding Medical Humanities, and that's what I do now.
Tell us the name of the anatomist.
Anna Morandi.
Anna Morandi.
Yeah.
So as I've told you off camera, I think what you do is really, really romantic and fascinating. So now, but beyond that, let's talk about history and the present. You know, we are in this uneasy time in public health. I think an easy time in the world in many ways. So how do you see history as being relevant to today? I'm hesitating to ask you how it teaches us about today, but I'm curious about your lens on today through such a learned approach to history.
Well, you know, I do think it teaches us about today, but it's not a one-to-one, correspondence. But it's crucial for understanding what's going on today. And I usually begin my medical humanities courses by quoting from St. Louisan T.S. Eliot, who talks about the historical sense is a perception not only of the pastness of the past, but of its presence. And we know the past lingers in the present as a residue, as an illumination, as a warning, even as an indelible stain. And I think being aware of that helps us comprehend this. And, when we think about COVID, I think it's pretty easy to see people's turn to the past in order to understand their contemporary moment, especially a crisis like a pandemic. I was kind of surprised to see my colleagues in history all over legacy media, in newspapers and magazines. And my normal life does not include interviews with CNN. It just doesn't happen. But when COVID struck Italy, that's the first place in the West to suffer a healthcare crisis and a mass mortality, I got called by CNN to say, we know Italy has this legacy of pandemic literature. Can you help us understand the relevance to this moment? Can it help explain this moment? So, I'm sure you heard a lot about Boccaccio too. Boccaccio, who wrote 700 years ago, but was incredibly relevant to the moment because he had the most graphic eyewitness account of the 1348 plague, right? That killed 50% of Florentines, including his father and his stepmother. And epidemiologists have been mining the frame story of the Decameron for a long time, but we all turned to Boccaccio also to think about civil repair during this period. And I'll just add finally that, Boccaccio is often called an escapist literature because it's the story of 10 nobles, right, who flee from Florence and this devastating mortality. And they hole up in their version of the Hamptons. They go to a villa and they gather in the garden and they tell stories. But I would say it's not escapist, it's reparative literature, because in that act of storytelling, you have the rebirth of civil society. And that is what I think history can they're guideposts. It's not, solutions or, like I said, one-to-one equations, but history is critically important for examining the human experience of something like a pandemic.
It is so hard to imagine, right? A pandemic with 50% of people being killed in a pandemic. It's really hard to imagine the social disrepair and how much work there is to be done in construction afterwards.
Right.
You mentioned, obviously, these examples of pandemic, which are historical moments that teach us about the present. Can you look back and think of other historical moments that are non-pandemic related that give you insight about this moment of, let's call it, rethinking of how we do what we do, this moment of loss of trust in institutions, loss of trust in health?
Yeah, I think that there are lots of moments where we can see loss of trust, and I think it's also there are lessons learned for people who are in public health, and sort of how they look at their own assumptions. I work on the Enlightenment, an era of radical reform, including in public health. And one example I can think of is, and I love to tell my freshmen about this because this was the Grand Duke of Tuscany. He's a Habsburg. He was only 18 years old when he takes the job. He is, by the way, the brother of Marie Antoinette, whose life didn't work out so well. But he comes to Florence filled with all of this passion to create a model Enlightenment state. And he does it. He arrives in 1765. In 1764, Cesare Beccaria's book on crimes and punishment, the first book to call for the abrogation of torture and capital punishment, is published. This 18-year-old is like, yes, he prohibits torture and capital punishment. He's the first sovereign in Europe to do so. He burns the instruments of torture. He reforms hospitals. He creates children's wards and maternity wards, special wards for the mentally ill. He lights the streets of Florence so that crime will go down. He inoculates his family against smallpox and his court to say to the public, it's safe, you do the same. But he makes, a really critical error. You have to appreciate, respect local values, customs, traditions. And he's so bent on making all these changes. He goes into the very important church, historic church, Santa Maria Annunziata, and there is this huge collection of wax ex votos. And these were how people saw health repair. They put little figures of their tumorous breast or their broken leg, these wax figures, hoping for divine intervention. Or they put figures of their healed body to say, thank you. And he melts it down as unenlightened, detritus of an old order. and he really loses public support. And so I guess that, I think, is a really important lesson about how you message your your public health protocols and reforms, and how you have to actually take into consideration local values and belief systems.
That's a terrific story, which has direct applicability, I think, for the moment. Let me ask you this. If you go back through history, guide us through the thread on history about how we've understood the production of health as coming from inside the body versus coming from outside of us. Like how has that understanding evolved over the past hundreds, a couple thousand years?
Oh, that's a good question. And, I mean, we can all look back to 2nd century AD Galen and humoralism, the liquids that dominated health and medicine for 1,500 years. 1,500 years. Yeah, it wasn't until Vesalius came in and shook things up and said Galen wasn't right about everything. So it was about balancing the humors, and you had all kinds of interventions like venesection and trepanning and dietetics, all of these things to balance your interior body, because you really couldn't do much about the external world. Like miasma, I mean, they thought that putrefying air was what caused pandemic, and the only thing you could do was leave the place where it is. But you have inklings of germ theory, for example, in a person like Fracastoro, this Paduan physician and poet. And I think we may be talking about the two cultures of science and humanities. And when they separate, a lot of these early scientists were also poets and playwrights. And he was a poet. He wrote a poem called Syphilis that was a bestseller at the time. But he comes up with the idea of foamies, seedlets of contagion that are on clothes and on surfaces. And everybody thinks he's completely crazy, but there is a kind of inkling of germ theory in that idea that there are outside things that we have to protect ourselves from. My world is mainly early modern. I work a lot on the early modern period, but it's with germ theory that we finally, and microscopy and all of these ways of imaging what is going on inside and outside the body that finally brings us to a contemporary understanding, a more contemporary understanding of where contagion and disease comes from.
Let's talk about the humanities.
Okay.
Let's zoom out for a second.
Okay.
You prefaced this, of course.
Yeah.
So, I mean, I think you've given us outstanding illustrations of how the humanities has direct bearing on population health thinking. But how do you see it? So how do you see, I mean, I'm fascinated by your notion that professors, doctors used to also be poets and playwrights. That's quite unusual today. So what's the intersection? What's the role of the humanities in informing how we understand the health of populations? If you were able to wave the proverbial magic wand, how would it be integrated?
I think they're being integrated all the time. I mean, I think about, okay, so just to go back for a second, we integrate the humanities when we create strong narratives for public health. Caitlin Jetelina was just here, and your local epidemiologist. So Dr. Jetelina said something I thought was really important. She repeated this phrase several times during her visit. She said, translating public health is an art form. And I think the two most important words there are translation and art form. And I take that literally. Humanities allows us to translate the human experience of health, illness, and care for accessibility. And this is an ancient idea. I mean, I think about somebody like Galileo. Well, Galileo, we know, was famous because of his defense of heliocentrism. But his dialogue on the two great world systems, right? his defense of Copernican heliocentrism was a comedy. It was a comedy, and he wrote it in the vernacular. He wrote it in the language of every day. He had 3 characters. And why did he do that? Because he wanted to persuade. And I think there are many brilliant writers in the world of public health. I think you are an incredibly great writer. Atul Gawande is a great writer. I think there are lots of great writers in medicine and health, and there's always an overlap between that. And, you know, data isn't going to do it. There has got to be a narrative that holds it together and that persuades. And we're seeing the problem with poor narration, right? Vaccine hesitancy, and we have to be excellent communicators if we're going to be able to improve people's health.
Such a great story. I didn't know about Galileo.
Oh.
I didn't know that his communication was in the TikTok of his time. But it really speaks, right, to using the vernacular, whatever it is, of an era to communicate.
That's right.
I'm asking you these big historical sweep questions. I realize I'm doing that, but if you'll permit me, can you think of an example when a humanistic approach to a problem changed how we operated in public health, how it provided us a lens that illuminated and inflected what we did?
I'm going to take you to another plague story, but it was a plague story written in 1827, and I think that it reverberates today. And this was Alessandro Manzoni's novel, The Betrothed. It's considered the national Italian novel. It's been a bestseller since 1827. And what does he do? He centers the poor. The poor are the heroes and the compassionate. But there is a historic event that takes place in the novel, and it, I think, is a cautionary tale that many have learned. And I'll just explain. If you go to Milan today, this is where the center of the story takes place. You go to the street right in the center of Milan, Via Gian Giacomo Mora. And this there is a burnt piece of wood. It's a memorial. During the 1630 plague, and Manzoni studied this. He went deep into the archive on this. The government of Milan knew that there was no remedy for the plague. And so they allowed conspiracy theories to fester. And the people, a mob, seeing a low-level health worker doing his rounds of buildings, accused him of spreading the plague. He was called an untore, an anointer, which was a kind of diabolical anointer, taking the pus of a bubo and spreading it. And the government knew that he was innocent. They arrested him, they tortured him, they asked him for his accomplices. In the throes of torture, he accused his barber, who was Gian Giacomo Mora. And the government, instead of confessing their lack of knowledge, that they didn't know how to address, there were no remedies, being honest and forthright, they blamed these people, and they did this horrendous public torture, all manner of torture. And they ended up executing, and then they burned the house down of the barber and put a column in its place that stood for 160 years. And on it was engraved the column of infamy. And it blamed these plague spreaders and warned all of Milanese that they would have the same fate if they did something, if they spread contagion. And it wasn't until an enlightened sovereign came in and knocked over that pillar and recognized that this was a colossal failure of public health and of government responsibility, and said, and shone a light on this tremendous crime. I I think that's a really important lesson. And by the way, this large engraving of this series of tortures is in the U.S. Surgeon General as a testament to what not to do.
It's been a long time since I read the Promesses Posse, but now I've got to go back and read it with that lens. Thank you.
Okay.
Tell me about empathy. I often think of what stories do is they build empathy, because we see the world differently, and we see the world through the lens of others. How do you see the humanities and the intersection, particularly of humanities and public health, that intersection with empathy and the importance of that for what we do?
I think it's critically important. I think sometimes we make a mistake that if you read a book, you're going to be an empathic person. I mean, I'm in the humanities. There are plenty of people in the humanities who are not particularly, empathic or wonderful people. I mean, again, there's no one-to-one ratio. But I think the fact that literature takes you out of your space and your moment and your experience and does allow you to see things through the eyes of someone else is really, really powerful. And it can change history. It can actually change history. I'm thinking of Giovanni Verga wrote a short story, it's just a few pages long, called Malaria. And he wrote all his work, he was really devoted to writing things as if they had written themselves. So it's through the eyes of villagers in a poor Sicilian town that is literally dying of malaria. And his representation had a huge impact. And the malarial mitigation campaigns that happened after unification were certainly influenced by the humanization of these people who were really sort of the forgotten part of Italy. Central Italy, administrative Italy, the industrial north, completely neglected the south. They were just expendable. And so I think that it can have an impact. And we know, during the height of the AIDS crisis, plays like Rent and Angels in America and films like Philadelphia and the Dallas Buyers Club still have an impact on our consciousness of the way other people, even seeing the AIDS quilt laid out on the Washington Mall with the Washington Monument at one end, and the just the vastness of that quilt and all the families and people who were gone, that has a huge impact, I think.
So every time I talk to you, I think it's so obvious that the humanities should be a core part of how we think about the health of populations. Yeah. And yet, there's a big gulf between the humanities and the work of public health, population health science. So why is that? Why is it that something that seems so natural as we're discussing it is actually so far from where we really are at, where the field is really at?
I don't know. I don't know if it's just a question of siloing. I mean, you see it all over higher education, but I think that there's a lot of things breaking through. I think our institution has some things to be very, very proud of. I think the Beyond Boundaries program, for example, that pairs faculty, not just from different disciplines, from different schools. And the philosophy is that the excitement happens in the space between these two fields of knowledge. And it's this, putting students in a position of constructive discomfort, right? It's in that creative, tense space that I think a lot of things can happen. We need to make room for much more of that. I think it's happening. I think sometimes we don't see it because people are partnering and collaborating all the time. I see it all the time.
That is wonderfully positive. I like that. How do we focus on our students in particular to make sure that they understand that telling the story of health is more than data.
Yeah.
It is about telling a story, and that is what ultimately works in the vernacular of the time, be that TikTok, be that a play, be that poetry, as we were discussing earlier. How do we make sure that our students, and of course we have to remember, students are drawn to public health coming from a particular life lens already. So how do we make sure that they understand the importance of this conversation?
You know, I think I've spent 30 years, I hate to even say this out loud, it's my 30th year at WashU, and I've spent 30 years collaborating with students in every part of what I do. And I think that's what I mean, you know, I don't want to say do what I do, but I do think they should be part of research. We should involve them in our teaching. We should involve them in our outreach. We should involve them in community service. We should partner with our students. And I think, you know, the reward is not just for the students. The reward is for us, our learning. It's a two-way, you know, exchange. And I just think that we have brilliant, brilliant students here, and they are passionate. And I think there is a yearning, particularly in this moment, in a cultural moment of unraveling, for this kind of work together, right? That crosses boundaries, that works with the community, that's deeply scholarly, but also, you know, practically impactful. I think we're all really looking for that, and I just the students can do it. They can do it. They have done it. They are doing it, and yeah.
There's so much of what you say that is hopeful, but let me just end. Last question on hope. Tell me what in this moment. I like what you said, in a moment of unraveling in many ways. What is still giving you hope in this moment, and how do we make sure that the humanities and public health come together to give hope?
You know, what gives me hope are, I will go back to my students. I am in awe of what they do. I am always impressed. I worked with 3 students to do this podcast. They were part of my disease, madness, and death class. And it was kind of a harebrained idea. And I just said, who would want to work with me on this? I had 3 students. One was an EMT, Evan Bradley. The other was Mishka Narasimhan, who I think you've met, and Timon Krasinski. 2 are now in medical school. 1 is in public health. And we went on this journey to learn about St. Louis and its traumatic racialized history of public health disparity, right? And we met public health, medical leaders, we met business leaders, we met nurses who trained at Homer G. Phillips. We met interfaith leaders. We interviewed all these people to get this. They did the work. They really did this incredibly beautiful job that they put together and produced in this podcast that will, you know, is going to live on after they've graduated now. And that gives me hope. More of that kind of collaboration gives me hope. And just reading my students' papers right now, I know that everybody's all worried about AI, you know, everybody's doing chat, but I am seeing incredible work by these students.
Well, it is conversations like this that give me hope. Professor Messbarger, Rebecca, thank you.
Thank you. Thank you.
And thank you for joining us.